NCLEX RN Practice Test 2026 questions to simulate the real exam experience. Question 1. Which patient is most likely to have an automatic internal cardioverter defibrillator, AICD, implanted? Option A. A patient with me without cardiac muscle damage. Option B. A postoperative coronary bypass patient. Option C. A patient with a history of ventricular tachycardia and syncope. Option D. A patient with a history of atrial tachycardia and fatigue. The correct answer is option C. A patient with a history of ventricular tachycardia and syncope. AICDs are indicated for patients at high risk of sudden cardiac death due to lethal ventricular arrhythmias like VTach or VFib. Question 2. A patient is scheduled for an MRI scan for suspected lung cancer. Which of the following is a contraindication? Option A. The patient is allergic to shellfish. Option B. The patient has a pacemaker. Option C. The patient suffers from claustrophobia. Option D. The patient takes antipsychotic medication. The correct answer is option B. The patient has a pacemaker. The strong magnets used in MRI can deactivate or cause a malfunction in a permanent pacemaker, making it a strict contraindication. Question 3. A nurse suspects a patient has developed a pulmonary embolism. Which symptom has the nurse most likely observed? Option A. The patient is somnolent. Option B. The patient suddenly complains of chest pain and shortness of breath. Option C. The patient has developed a wet cough and crackles. Option D. The patient has a fever, chills, and loss of appetite. The correct answer is option B. The patient suddenly complains of chest pain and shortness of breath. The sudden onset of dyspnea, shortness of breath, and pleuritic chest pain are the hallmark signs of a pulmonary embolism. Question 4. Workup reveals the presence of a rapidly enlarging abdominal aortic aneurysm. Which action should the nurse expect? Option A. Admission for observation and medication. Option B. Admission for sclerotherapy. Option C. Admission to surgery for resection. Option D. Discharge home with cardiologist follow-up. The correct answer is option C. Admission to surgery for resection. A rapidly enlarging aneurysm is at high risk for imminent rupture, which is a surgical emergency requiring immediate repair. Question 5. A leukemia patient has a platelet count of 25,000/microliter. Which action should be included in the care plan? Option A. Monitor for fever every 4 hours. Option B. Require visitors to wear respiratory masks. Option C. Consider transfusion of packed red blood cells. Option D. Check for signs of bleeding in urine and stool. The correct answer is option D. Check for signs of bleeding in urine and stool. A platelet count below 50,000, thrombocytopenia, puts the patient at high risk for spontaneous bleeding. Monitoring urine and stool for blood is essential. Question 6. A nurse teaches family members about infectious precautions for a leukemia patient. Which statement indicates the family needs more education? Option A. We will bring in books and magazines for entertainment. Option B. We will bring in personal care items for comfort. Option C. We will bring in fresh flowers to brighten the room. Option D. We will bring in family pictures and get well cards. The correct answer is option C. We will bring in fresh flowers to brighten the room. Fresh flowers and plants are prohibited for neutropenic patients because the soil and water can harbor mold and bacteria, like Pseudomonas, that cause infection. Question 7. A nurse is caring for a patient with acute lymphoblastic leukemia, ALL. Which of the following is the most likely age range of the patient? Option A. 3 to 10 years. Option B. 25 to 35 years. Option C. 45 to 55 years. Option D. To over 60 years. The correct answer is option A. 3 to 10 years. ALL is the most common childhood cancer, with the peak incidence occurring in children between the ages of 3 and 10 years. Question 8. A patient is admitted for diagnosis of suspected Hodgkin's disease. Which symptom is typical of Hodgkin's disease? Option A. Painful cervical lymph nodes. Option B. Night sweats and fatigue. Option C. Nausea and vomiting. Option D. Weight gain. The correct answer is option B, night sweats and fatigue. These symptoms, such as drenching night sweats, persistent fever, and fatigue, are common systemic manifestations of Hodgkin's disease. Lymph nodes are typically painless. Question 9. If the diagnosis of Hodgkin's disease were correct, which of the following cells would the pathologist expect to find? Option A, Reed-Sternberg cells. Option B, lymphoblastic cells. Option C, Gaucher's cells. Option D, Reeder's cells. The correct answer is option A, Reed-Sternberg cells. The presence of Reed-Sternberg cells, large, multinucleated Alli cells, in a lymph node biopsy is the definitive diagnostic marker for Hodgkin's disease.